Many women live with painful periods thinking it's normal, but it may actually be adenomyosis or endometriosis. These two conditions sound similar, but are completely different, and today, I'll explain the difference in the simplest possible way. Let's start with endometriosis. Normally, the lining inside your uterus called the endometrium builds up and sheds every month as your period. In endometriosis, this lining grows outside the uterus. It can grow on ovaries, fallopian tubes, bladder, intestines, even pelvic walls. Every month, these tissues bleed but have nowhere to go, causing severe period pain, painful intercourse, pain while going to toilet, fertility problems, heavy bleeding. Now let's talk about adenomyosis. The endometrial tissue grows inside the muscular wall of the uterus. So instead of growing outside like endometriosis, it grows deep inside the uterus muscle itself. This makes the uterus larger, heavier, extremely painful during periods. More likely to bleed heavily. Some women say it feels like my uterus is dragging and pulling downward. Here's the simplest way to remember. Endometriosis equals outside the uterus on ovaries, tubes. Pelvis. Adenomyosis equals inside the uterus muscle. Inside the wall of the uterus. Pain is more sharp, stabbing. Deep in endometriosis, and adenomyosis pain is more heavy, dragging, cramping. Bleeding in endometriosis gives maybe normal or heavy. Adenomyosis gives usually very heavy periods, plus big clots. Endometriosis affects fertility more, and adenomyosis affects fertility mainly in advanced cases. Endometriosis often starts in teenage girls and young women. Pain usually worsens over time. Adenomyosis usually appears in women over 30 or after childbirth. The uterus becomes enlarged, sometimes up to double in size. Diagnosis can be tricky. For endometriosis, ultrasound may show cysts. Endometriomas. Laparoscopy is the most accurate test. For adenomyosis, ultrasound or MRI can often detect it. The uterus may look enlarged or bulky. Both conditions can exist together. Both conditions depend on severity. For pain relief, anti-inflammatory medicines, hormonal pills, progesterone therapies, Mirena IUD for endometriosis, laparoscopic surgery, removing endometriosis, lesions. IVF, if fertility affected. For adenomyosis, hormone therapy. In severe cases, hysterectomy, removal of uterus. For women who do not want future pregnancies. To summarize, endometriosis is outside the uterus. Adenomyosis is inside the uterus muscle. Both can cause severe pain and heavy periods. Both are treatable. And pain is not normal. If you feel these symptoms, see a gynecologist.